Assalamu alaikum.
Salam.
First, I will start by washing my hand. Could you please give me a minute to read the paper?
Okay.
Okay, hello. I am Abdulaziz Bahadur, a third year medical student. Could you please confirm your name and age?
My name is Abdulatif. I'm 21.
Okay, Abdulatif, I have been asked to do a pericardium examination, which might include exposing your abdomen and palpating some parts. Is that okay with you?
Yes.
Okay, Abdulatif, I have insured your breaths by closing the door. Before standing, Abdulatif, are you currently in any pain?
No.
Okay, Abdulatif, I will let you lie down on the bed. I want you to be 45 degrees above the bed.
Okay.
And ideally, I'll expose Abdulatif. I'll remove this shirt. But for the sake of this time, I will leave it like this. Okay, the patient looks normal. He is not in distress. His body build also is normal. He is not overweight or obese or slim. He has no discoloration, no cyanosis, no pallor, no jaundice. He has no obvious deformity, no abnormality, asymmetries, or obvious dysmorphic features. Also, he is not connected to any IV saline or ongoing therapy or oxygen mask. And also, ideally, I'll order the vital signs, which might include the respiratory rate and the oxygen saturation. Also, it might include the pulse rate and blood pressure, and finally the temperature. And I will order also the BMI and the height and the weight of the patient. Okay, now I will examine the forearm region. I will start by assessing the radial pulse. The ideal way is to wrap my hand around his wrist, and I will be in the exact spot of the radial artery. I will press it by 2 fingers, and I will wait for 15 seconds, and I will count the pulses, and after that I will multiply it by 4. So ideally it will be 76 pulse per minute. After that, in the exact same spot, I will assess the rhythm. So it's normal. It's not irregular or it's not irregular regular or irregular. Okay. Now I will assess the characteristic of the pulse. So it's normal. It's not the volume. It's intact, and the strength of the pulse is normal. After that, and ideally, I will assess the symmetry between two hands, radio to radial delay, and I will do the radio to femoral ideally. After that, I will assess the collapsing pulse in the exact same spot. Before doing that, I will ask the patient if he have any pain around his shoulder joint.
No.
Okay, because I will raise your hand fast. Okay. Okay, 1, 2, 3. And I will assess if there is any collapsing pulse. So in this case, it's normal and there is no collapsing pulse. After that, I will assess the temperature. So could you please spread up your SUR? I will assess by comparing both hands. So it's normal here. Okay, in the forearm, it's normal. And in the arm also, it's normal. Okay, relax. Okay, now I will do the pericardium examination. I will start by letting the patient expose his chest to have ideal exposure. Okay. First, I'll start with the inspection. There is no scars, there is no skin changes. Also, there is no discoloration. There is no devices, no pacemakers. Also, there is no deformities, as I can see. After that, I will go with the palpation. I will start by palpating the apex beat. Come closer. Okay, first of all, I will go to the sternal angle of Lewis, which is a prominence in the middle of the chest. Okay, I'm going to lateral to it. I'm in the second intercostal space. I'll put my middle finger here and my index finger to the second space, which is the third one. Then I will shift the fingers, now the middle and the third, and this is in the fourth. I'm going till I reach the fourth space. I'm going with the right hand here and going to the mid-clavicular line till here. Now I'll press gently and I will assess if there is any apex beat or no. Okay, I can feel the apex beat. Okay, so it's normal. After that, I will assess the thrills by my hand to all the valves of the heart. I'll start with the mitral valves because there is no thrills. Okay, going to the tricuspid valve. no thrills. Going to the second intercostal space to see the pulmonic valve. Okay, no thrill. After that, going for the aortic. Okay, there is no thrills. We're going now for the parasternal heave, which indicate right ventricular hypertrophy. We can assess it like this, parasternally, or like this, whatever you like. Okay, it all looks normal. So that for the palpation part. For the percussion, ideally we'll do it, but since there is no clinical value for it, so I will skip it for now. Okay, moving on to the auscultation part. Okay, first of all, I will assess all valves, but I will start by the mitral valve. I will assess the mitral stenosis by using the bill. And meanwhile, I will see the carotid artery to synchronize the pulse. I will put my index finger to Adam apples and my ring finger to sternocleidomastoid, and it should be in the middle to synchronize the S1 and S2 sounds. Okay, there is no abnormal sounds. I will let the patient to lie down in his side to exaggerate the sound while keeping the stethoscope on the pill side. Okay, there's no abnormal sound. Lie down back. Now I'll assess all the valves by using the diaphragm for the high pitch sound. I'll start by the mitral valves. Okay, it's look normal. And don't forget to put your hand to synchronize the S1 and S2 sounds. Going on to the tricuspid valve. Also looks normal. Moving on to pulmonic valve. Also looks normal. And lastly, moving on to the aortic valve, looks normal. Now I'll let the patient sit to see if there is any aortic regurg while keeping the stethoscope on the diaphragm side. Okay, it's normal. Okay, now I'll assess if there is any crackles in the base of the lung. Okay, starting by the right lung, in the base of the lung. There is no abnormal sound, nor crackles. Going to the left lung, left base. Okay, also looks normal. Okay, I will help the patient to cover him up. And that for the pericardium examination. Moving on to the leg part, I will examine it by exposing the patient. After that, I will assess the pitting edema to see if there is any congestive heart failure. Ideally, I will put two fingers across across the shaft of the tibia and apply gentle pressure. And after that, I will release my hand and see if there is any pitting or no. In this case, it's normal. After that, I will assess the dorsalis pedis pulse. So how we will locate it? Ideally, when we tell the patient to flex his big toe, the extensor hallucis longus tendon will appear. So we'll go lateral to it and we'll apply pressure by two fingers. And we will assess it as we assess the radial pulse and the carotid pulse. Okay, in conclusion, I will cover the patient up and help him. And I will thank him. Thank you for your cooperation, Abdul Latif. And finally, I will wash my hand.